Well, awesome, everyone. Thank you. I'm Joshua Capel. I'm one of the founding partners of Vicente Sederberg. I'm also, the lead partner on our emerging therapies and entheogens practice, where we've been, representing clients in some capacity in this space for, probably over 5 years now. From anywhere from helping draft legislation and setting up nonprofits to, to helping companies with due diligence or financial raises. But a lot of the time over the last number of years, really the question that I get is how legal are psychedelics and what is the legality of them? And there's a lot of confusion. You see companies selling mushroom spore or psilocybin spores. You see companies selling mushroom chocolates online or in Venice Beach, and there's a lot of confusion around the legality of psychedelics. And big picture, on one hand, psychedelics are more legal than cannabis, at least at the federal level. You have ketamine clinics, if you consider those to be a psychedelic, popping up all over the country. You have USONA and Compass that have emergency use authorization from the FDA. You have MAPS, who has had a very successful, phase 3 trial. I guess they've had emergency use authorization for psilocybin from the FDA, and MAPS, has had a very successful trial with, has had a very successful, trial with MDMA. And, but on the other hand, it's like psychedelics are still way farther behind than cannabis, circa 1997, just after the passage of Prop 215, where we've had one state that has passed, a measure that has provided safe and legal access to psilocybin. And we've had a dozen or so cities that have passed measures, that have generally have made a statement around, this being the lowest law enforcement priority, for entheogens or psychedelics. And, but I will say that there is a lot of movement, that's happening in multiple states, across the country, in multiple cities, really pushing for safe access for everyone that needs, psychedelic plant medicine. And so that's what this webinar is about. Thank you again so much for coming. With that, I'm going to turn things over to our moderator, Barina, who co-leads our Entheogens and Emerging Therapies practice, and and she'll guide us through.
Thanks, Josh, for the introduction, and thanks everyone for coming. It's a really exciting time to be involved in this field, as I'm sure all of you that are listening are aware of. There's just a lot of movement happening, and we have way too much information that we want to cover in this webinar. So we've been strategizing about how to deliver it to you in the most exciting and efficient way possible. So I'm going to just talk a little bit about some recent highlights, kind of at the headline level, of a few things that are moving that I find really interesting. And then we're going to dive into sort of an increasing amount of detail, state-specific detail from there. So I'm just going to give you guys some really cool highlights of things that are moving. These have not passed yet, but they're all sort of in flux, bills or laws that have been proposed. Virginia recently introduced 2 separate bills in the House and the Senate to reduce penalties for possession of certain hallucinogens down to a civil penalty, down from a felony. The 2 bills are very similar to each other. They're introduced by 2 separate lawmakers. One bill addresses only psilocybin and psilocin, and the other addresses psilocybin, psilocin, peyote, and ibogaine. So that's a cool piece of legislature that's been proposed. In Washington, they recently proposed SB 5660, which would allow adults to use psilocybin under the support of a trained and state licensed psilocybin service provider. So it would create a state-regulated psilocybin industry, or industry for psilocybin services, somewhat similar to what we have in Oregon, which we'll dive into in more detail in a minute here. Unlike Oregon, there's a lot of built-in focus on access and social equity in the Washington bill, which is cool. It's interesting to see how that'll play out. It includes things like reduced fees and training opportunities specific to lower income areas and populations. In that system, if it passes, applications for various roles in the psilocybin industry in that schema will be accepted in January 2024 after they have an 18-month period to develop the regulatory framework. In Pennsylvania, in October, two legislatures, one a Democrat, the other a Republican, introduced House Bill 1959 called the Public Health Benefits of Psilocybin Act. That bill directs the Pennsylvania Department of Health to administer a clinical research program investigating the utility of psilocybin to treat a number of different mental health issues. Priority is going to be given to research with veterans and retired first responders and their families. This is somewhat similar to Texas, which actually passed a bill in the summer of 2021. I'd actually say where Pennsylvania is going is somewhere between Texas and Oregon. Texas actually passed a bill in the summer of 2021 directing their Department of Health to conduct a research study into the efficacy of psilocybin, MDMA, and ketamine. So this has that feel to it, but it's psilocybin specific. And then just last month in New York, a lawmaker introduced a bill to legalize psilocybin mushrooms for medical purposes and to establish facilities both for the cultivation of psilocybin mushrooms and for administration to patients. So again, we're looking at a closer to Oregon regulatory scheme. So that was just a very fast rundown of some developments that I think are exciting, and we'll see how those go. I'm going to pass it back to Josh right now so that you can give us a little bit more detail about the current state in California.
Yeah, thanks, Bruna. As always, all eyes are on California. The Senate Bill 519 has been sponsored by Representative Weiner, has been making its way, through the House and Senate. There's a landmark piece of legislation, that decriminalize, certain psychedelics, within, a limited amount, and also permits, the non-commercial, facilitated or supported use of psychedelics. There are limitations, around where these substances could be used. The age limits, at the age of 21. But the bill also has a couple other pieces. Legalizes psilocybin spores in California, which is something that's currently illegal. Also legalizes paraphernalia related to the substances that are being decriminalized. Where it is right now, it's been stalled in the Appropriations Committee. There's been a changing of the guard in the California Appropriations Committee. And, but there's a really good coalition of folks in California working on this bill. And the state of California the state legislature and Senate in California have until August, to pass this bill. So very exciting, piece of legislation, making its way forward in California.
Awesome. Sorry, I'm having a technical issue here. Thanks, Josh. So that was sort of where we're at with California. I'm going to talk a little bit about Oregon before we move on to Colorado specific stuff. As most of you that are watching this probably know, Oregon passed two very exciting drug-related measures in November of 2020. They passed Measure 109, which was called the Oregon Psilocybin Services Act, which legalized psilocybin-assisted psychotherapy, which I'll discuss more in a minute. And they also passed Measure 110, which went into effect in February 1st of 2021, called the Drug Addiction Treatment and Recovery Act. And that essentially reclassified personal possession of small amounts of drugs down from a felony to a civil violation with a $100 fine. And that fine can even be avoided if the person agrees to seek treatment for any drug problems they may have. For possession of slightly larger amounts of some drugs, we won't get into the quantities here, but Measure 110 reduced the penalty down from a felony to a misdemeanor possession. The treatment services offered to folks seeking treatment under Measure 110 are funded by marijuana tax revenue, which is cool. And then it maintained criminal penalties for drug sales, other commercial activities, and possessions of larger amounts greater than those two categories. So that was Measure 110. Measure 109, which I want to talk about in a little bit more detail, basically set up a statewide scheme for regulating and licensing psilocybin services, and basically addressed all the pieces necessary to get a patient to have a psilocybin experience, a facilitated psilocybin experience. So the measure set up a framework to address the manufacturing, transportation, delivery, tracking, sale, and purchase of psilocybin products. The system is under the direction of the Oregon Health Authority, and Measure 109 set up Oregon Psilocybin Advisory Board, which Measure 109 actually set up the qualifications for all the members of that board, very specific qualifications. And that board was established and now is in the process of making recommendations to the Oregon Health Authority. From when it went into effect, there was a 2-year period where the board and the health authority would work together to establish rules and regulations about how exactly Measure 109 would be implemented. And we're in the middle of that process now. That 2-year period is timed to end at December 31st, 2022. And so far, the officials responsible for that say that they're on track for that timing. And right now they're in the midst of trying to create recommendations for protocols related to training of facilitators, licensing, how we monitor compliance of those facilitators, how we track psilocybin products, how the case management systems are handled for various patient cases. So they're in the process of building that infrastructure and making recommendations to the Oregon Health Authority. We get so many questions here at BS about when they can start, when various folks can start working in Oregon under this scheme. And what we do know is that applications related to any of these pieces, the manufacture, sale of psilocybin products, or the provision of the psilocybin services, those applications will be accepted starting January 2nd, 2023 yet. And so we don't really have an answer, as far as I know, as to when that service centers are actually expected to be operational. And one last thing I'll say about this is that there's an interesting issue about what will happen. It's sort of being hyped and discussed right now around microdosing in Oregon. There's nothing in Measure 109 that addresses microdosing, but it's not, the actual dosing is not addressed. So there's nothing that ties it to non-microdosing. So there's some interesting conversations right now about whether the regulatory scheme that is being developed in Oregon will have any room for microdosing. And with that, I think that's all I want to say about Oregon. I would like to introduce Jordan Wellington. He's the managing partner at BS Strategies, which is a government relations firm that works with both cannabis and psychedelic policy at the state level. So I'm going to pass it to him, and he'll kind of move us forward from here.
Thanks, Marina. Excited to be here today and talk to everybody about what's going on in the Colorado legislature around psychedelics reform, and going to do my best to sound somewhat coherent because the plague has officially hit the Wellington household, so we're all kind of struggling through that fun COVID brain fog. So I think the first thing I get to do is I get the privilege of introducing Alex Valdez, who is a state representative in Colorado, who has recorded a really awesome message for us. Representative Alex Valdez is a Denver Democrat and has long been a champion of drug policy reform issues, not only working closely with the cannabis industry on a variety of pieces of legislation, but actually also sponsored legislation last year that we worked on with him that increased possession limits in Colorado of cannabis from 1 to 2 ounces, as well as created a bunch of offenses that are now eligible, that were previously ineligible for record sealing, and are now eligible for record sealing. And so we really appreciate all of the efforts Representative Valdez has done in kind of setting up over the last couple of years eligibility for more folks to get pardoned for cannabis-related crimes, as well as have their records sealed. And this year he has introduced a piece of legislation that would help create opportunities for the state to determine how to move forward with psychedelics reform. So without further review, here is Representative Valdez.
I'm Representative Alex Valdez. I'm very excited this year to be bringing a bill to address and to look into how we might be able to use plant-based medications to help folks experiencing mental health issues. It's an exciting time as we learn more and more about how the earth has delivered so many different things that help people to get well. We feel that maybe this is another evolution as we as human beings start to embrace the natural environment and the resources given to us to solve a myriad of everyday issues. The reason I'm so excited about this bill is that Denver, where I represent, and the state of Colorado has seen a rapid increase in the number of mental health issues, not only during COVID, but before. And anything and everything that we can do to bring an end to the mental health crisis we are experiencing as a state, as a nation, as a city, we should do. So I'm really excited about this bill. What it's gonna do, or what we hope to do, is really study how can we use plant-based medications as we move forward and attack mental health from the perspective every direction. What we want to do is a multitude of things, and we want experts to sit at the table and decide, how do we do this? What are the different pieces? I'll list a few of them for you today, but as we go through the process, we hope this bill continues to evolve. We hope those of you who are experts in this area will continue to work with us to ensure that we are creating the best possible piece of legislation to help address mental health issues, which we know is such an incredibly important issue here in Colorado today. So, amongst other things, what this bill will do is define plant-based medications. Sometimes it's those simple things that need to be done. It will also help us to understand how we can safely produce the product. We'll bring experts to the table that can talk about production, distribution, how we keep this product safe, determining proper dosages. That's something that we've seen is so incredibly important to prevent issues down the road as we seek implementation. Understanding traditional uses. These are not new substances. These are things that have been used for generations, thousands of years by indigenous folks for a variety of reasons. And we want to know more about that because oftentimes the past can unlock keys to the future for how to use plant-based medication. And then analyzing impacts such as how will this affect somebody's employment policy? How will this affect the ability for somebody to get a job? And I think most importantly, what we'll be looking at is, should we, and if so, how do we decriminalize plant-based substances so that we can move forward with research, so that we can move forward and protect the physicians who are doing groundbreaking research. Colorado has always been a leader in plant-based medications. We were early on the train from medical cannabis. We were the first state in the nation to legalize recreational plant-based medication. And we know the citizens of Colorado understand that there is environmental solution to many of our everyday problems. So we're really excited about this. How the bill will work functionally may change, but as it's written right now, the governor's office will appoint a number of different folks. We're looking at 17 total members of the task force. That includes everybody from traditional practitioners of medicine using plant-based to First Nation representatives and representatives from all different aspects of life where it comes to medical issues. 17 people will be hopefully added here to discuss how do we schedule these substances so that we ensure that they stay in the hands of those who need them and that they're dosed properly and treat people for what we really want to treat people for, which is mental health issues. So it's really an exciting bill. I'm very excited to be a part of this process, and I'm very excited at the potential that we may find a way to really make an impact on mental health here in the state of Colorado by embracing something that the earth gives us naturally. So I'm just so excited to work with everybody. I really appreciate everybody taking the time to engage this process. We want to create the best possible piece of legislation. We want a study that's going to give us as many of the answers as we need to do a safe implementation, to do everything the right way so that we can lead, which is something I think Colorado should do, something that Colorado has done, and something that I, as an elected leader, really believe is what we need today to escape some of the issues that we're facing. So again, thank you very much. Please follow this process as we go through it. Please bring us those stories of folks who have been truly helped by this sort of therapy. And let's tell a story of how we can use something that the earth gives us naturally to solve mental health issues, which we all know are so very important. So thank you very much. Please feel free to reach out anytime. My email is repvaldez@gmail.com. And thank you again for your support of this groundbreaking research in this groundbreaking area of medicine. Hi.
So I guess although he's not on the line, we'll say a quick thank you to Representative Alex Valdez. Really appreciate him taking some time to record a video to share with us about why he is sponsoring the legislation in Colorado. And, unfortunately, he couldn't make it because he's busy at the legislature being a state representative. But want to give a little bit of a description about what has happened thus far throughout the process, kind of where we started, where we are now, and then most importantly, opportunities for folks to get engaged. So, some of the folks on the line may recall last year there was an effort with Senator Joanne Janal to introduce legislation around psychedelics reform in Colorado. Unfortunately, due to a variety of issues at the legislature last year, we could not get that bill introduced. And so we came back this year with another piece of legislation. The initial goal of the legislation was to essentially decriminalize, small amounts of possession, consistent with the initiative, the lowest law enforcement priority initiative that we worked on collectively, and Kevin Matthews on the line, and a lot of other folks contributed to. And this would have also created pathways for safe access and kind of dealt with a lot of the other issues relating to psychedelics reform after we were able to first run through some basic decriminalization. We put together an initial bill draft, and the bill drafter herself actually identified a variety of concerns and questions just through the drafting process about deschedulization versus rescheduling. Since we are descheduling, since we were originally going to deschedule it, what amounts would be a crime? If there were possession limits, what above that, what punishments should exist? And all of these other questions. And then there was additional questions about what substances should be decriminalized. And through this process, through conversations with advocates, supporters, therapists, as well as with our good, fine friends at law enforcement, Senator Janal and Representative Valdez decided that, at least from the introductory perspective, they were going to push on having a panel to answer a lot of these questions, because at the end of the day, you get kind of squoze up against legislative deadlines. And if you don't have answers to questions that come up during the stakeholder process, those questions are clearly going to come up during the legislative process and could hurt the chances of this bill to pass. And so far, I'm really excited to say that we heard from our lobbyists today that there's tremendous excitement about this legislation at the Capitol. And we think that, we have a really good opportunity to introduce, or have already introduced, a really great bill, and look forward to working through the process to make it better. Let me jump to the next one. So the first thing that the bill does is it defines plant-based medicine. We don't think that this is a perfect definition, and we've heard from stakeholders that they would recommend certain changes to be made. So the way we look at this is that this is a placeholder definition just to kind of establish some initial structure around what we mean by plant-based medicine. And on the priority list of things that this policy review panel will be tasked with doing is making any adjustments, amendments, and changes to this definition through recommendations to the legislature. So this is an initial definition. It can be amended throughout the legislative process, and then will again be reviewed, because we feel like this is not only an evolving area, but over time we expect more and more experts and advocates and knowledgeable people to come to the table, and that will allow us to kind of continue to improve this policy. So what is this policy review panel going to talk about? Well, first of all, it's going to recommend, and the thing that we're, one of the things we're most interested in is recommending how to reclassify plant-based medicines, how they should be decriminalized. Are there different weights and measures that need to be handled? How will the difference between psilocybin and psilocin be handled, and create this new definition? We also are very concerned about production and safe access. So we'll talk about methods for production, distribution, and access, testing, so that people both know dosage of what they're taking, but also ensuring that products are free from contaminants and things of that nature, as well as discuss potential impacts on physicians and barriers in state law. We will then go through kind of oversight and regulations, and also discuss traditional uses and try to construct a recommendation that makes sense going forward in Colorado, that kind of respects both the processes that have occurred, or both the kind of uses that have occurred historically, as well as kind of more modern therapeutic uses, and with the overall goal of, ensuring safe access, protecting community, and making sure that we have really strong policies in Colorado that encourage, plant-based medicines to take really their rightful place in society. The meetings are supposed to start in October with a report January 1, 2024, so that the legislature can thereafter take up those changes. So Representative Valdez mentioned that we had 17 people on this panel. So you can see the list of folks here. The goal was really to try to do everything that we can to include as many groups as possible. One of the beautiful things about creating a panel like this and the legislative process is that there is no limit on the folks who can participate in any way, shape, or form. This is kind of, I wouldn't even say our initial list. We had our initial list, received a bunch of stakeholder feedback. We've added folks to this panel based on that. And again, I think it will continue to live and breathe throughout the legislative process, where more folks are going to come forward and suggest changes and additions, and we're excited to hear from them because that will help us really get the best possible panel together. One of our main goals here was to kind of bring all voices from a variety of places together to ensure maximum buy-in from all participants in the state of Colorado. So even though we understand that there are probably some concerns about this kind of stuff from law enforcement, we feel strongly that having them at the table ensures greater success and the longevity of the program, as opposed to just, keeping them out of the process, which has been pretty typical for how Colorado has handled all this kind of policy making in the past. And so finally, and probably most importantly of all, last slide in my spiel, is the Colorado legislative session has already started and runs through May. The bill is introduced, and we believe that it could go to its first hearing on February 15th. Quick how a bill becomes a law schoolhouse rock review for everybody. It's going to have to go through its first, at least one committee in the House, followed by 2 votes on the floor of the full membership, and then repeat that process in the Senate. So this bill language is not final by any means, and there are many, many opportunities throughout this process for your voice to be heard. Questions that we have are, who else is missing from the review panel? What topics are missing from the list of things that we want them to discuss, analyze, and make recommendations on? And so whether it's before this potential meeting on the 15th, throughout the legislative process, and at any point, we just hope folks can reach out, get involved and get engaged, because the reality is that's kind of the linchpin to our democracy. Is we need the expertise from everybody in the community to make sure we craft the best possible legislation, and that includes supporters, opponents, and everybody else in between. And so we really hope that anybody interested will reach out and share their thoughts, and we'll do our best to make sure that everybody can have their voices heard throughout this process. And so appreciate the opportunity to speak today. Really excited about the progress that Colorado is making on this front, both through the legislative session and what Kevin is going to talk about shortly. And really think that the bottom line appears to be that the future continues to be bright in terms of reform in Colorado, and excited to continue on. So before I kick it to Kevin, there were a couple of questions, but I don't know if we want to just hold those to the end, or should I jump in? Jen, just.
Jordan, let's wait till the end. I think we'll have about 10 minutes at the end, and we can just kind of go through all the typed questions and hit the highlights.
Sounds good to me. All right. Thanks, everybody.
Hey, everyone. Hey, Jordan. Thank you so much. Barina, Josh, Jen, really honored to be here. Thank you for including me in this. And I'm excited to, as Jordan mentioned, talk about a couple of things here, specifically what's happening in Denver post our 2021 comprehensive report that we submitted last November, and to also speak about our recent submission of the Natural Medicine Health Act of 2022. which will be a ballot initiative to appear on the ballot for the general election this November. So I'm going to talk briefly about why does 2022 matter. I'll go into our review panel, talk a little bit about our comprehensive report, and then give an overview really of the Natural Medicine Health Act of 2022 and look at some of the key policies and talk about the timeline here. So why 2022? Well, about a year ago, about 10 months ago, the Denver Psilocybin Mushroom Policy Review Panel unanimously agreed that decriminalizing psilocybin mushrooms in the city and county of Denver has not since created any significant public health or safety issue, which was huge because some of the members on our panel include our Denver District Attorney, Beth McCann, members of our city attorney's office, members of local law enforcement from the Sheriff's Department and the Denver Police Department. And so that was based on the data that we collected over the last, at that point, just over a year, an incredible statement to make, knowing that we had a lot of data coming in to make that statement. So in terms of 2022, right now, according to Mental Health America, and this is 2021 data, Colorado is the 47th worst ranked state in the country for mental health. Now that's a lot of factors are included there, but that's specifically in terms of adults with mental and behavioral health issues, and also access to mental and behavioral health services. And so it's pretty clear that it's important that we have effective, accessible alternatives that can address these issues. In fact, there was a recent it's a Harris poll that came out just a couple of days ago that said that 65% of Americans who are suffering from mental and behavioral health issues would like access to psychedelics. And of course, looking at Colorado, so much of our mental and behavioral health issues have certainly been exacerbated by the COVID-19 pandemic. And so we need alternatives. And at the same time, we also know that psychedelics is not simply a mental health issue. It's a cultural issue. Honestly, in my opinion, it's a human issue. It may even be a human rights issue. For example, in Denver, Denver, to my understanding, with our psilocybin decriminalization here, is the only city in the country where our decriminalization is under the Human Rights Code here in Denver. And so if we're, acknowledging that, yes, it's a mental health issue, but we're also honoring historical, traditional, and indigenous use of psychedelics, then we know that people really deserve to choose how they engage with and work with these medicines, with these sacraments. And I believe that people deserve to choose whether to pop a pill or eat a plant or fungi in the comfort and safety of their own home, or in a healing center, or in a clinical setting. And in terms of the Natural Medicine Health Act of 2022, that certainly is what we're working to accomplish here. So in terms of the Denver Psilocybin Mushroom Policy Review Panel, we first convened in person in February 2020. That was at at City Hall. The role of the panel was to really assess and review the impact of making psilocybin the lowest law enforcement in the city from a health and a safety and a fiscal perspective. And we had 6 meetings over the course of about 15 months, and just talked to so many people, advocates, educators, professionals, to really bring members of our panel up to speed on, what's the historical use of psilocybin, what's the therapeutic potential, how are folks using it. And as a result of our work, we submitted our 2021 comprehensive report, as it says here, to the Budget and Finance Committee of the Denver City Council. That was last November. The next slide, thank you. So we presented this comprehensive report to the Denver City Council on November 9th, 2021. And the report's extensive. It's just about 60 pages, tons of notations in there, a lot of data that we've collected, a lot of really good information. And what it covered was looking at the traditional and historical use of psilocybin. So going back, thousands of years in terms of how psilocybin has been used and may have been used in terms of the arc of human history. That also included some of the early research that happened back in the 50s and 60s. We looked at the modern research, more specifically, a lot of the research that's coming out of that has come and is still coming out of Johns Hopkins University and other universities across the country and the world in terms of efficacy for psilocybin as a treatment for depression, anxiety, substance abuse disorder, things like that. We also talked about our meetings, details on, who we spoke with, what we learned. And then really importantly, we took a deep dive into safety and use data. So that looked at arrests, that looked at hospitalizations. We discovered that since decriminalization, arrests were reduced by just about 50%. And a big majority of arrests for psilocybin included other illicit substances. We go extensively into our multi-responder training, which I'll talk about here in just a second. And then, of course, a big, like the main role of the Denver panel was to make recommendations to the Denver City Council on how to move forward here. And so with the multi-responder training, is going to train all of Denver first responders. So EMS, police, fire, members of Denver Health, and licensed therapists, et cetera, on risk reduction techniques for psychedelic crisis. And this is critical because Denver will be the first city in the country to actually train all of our law enforcement personnel and first responders on how to appropriately and effectively and safely respond to a person who's undergoing some kind of a psychedelic crisis, and really reduce risk for both the individual who's involved and our law enforcement. Denver already has such a strong history of really evolving how the city responds to both mental health issues from an enforcement perspective and drug enforcement. And this is just one more step to make sure that we're both keeping our residents safe, and that law enforcement really has a better understanding of how to, identify a person who's undergoing a potentially, harmful situation with psychedelics. So in terms of the recommendations that we're making and we made to the Denver City Council last November, the very first one is to deliver this multi-responder training. Right now, there's a contract between the city attorney's office and the city itself with MAPS. MAPS is spearheading this training. They've created the curriculum, and they're going to be the one deploying this training to all of our first responders. And we're looking at a pilot test in the city here in hopefully this spring. The next recommendation is to create a data collection and reporting system so that we can better track adverse events related to the use of psilocybin. And also, we'd love if the city and county of Denver, in partnership with other organizations, would also create more public service announcements and public education regarding the safe and responsible use of using psilocybin. The big recommendation here is that we want to decriminalize both gifting and sharing psilocybin and authorize communal use. So the grow, gather, gift model that I think many of us are familiar with. And, that in particular, there is a state law right now that even says that, giving away a Schedule I substance can be considered felony distribution. So we wanted to make sure that at the very least, gifting and sharing and communal use is authorized in the city, and especially for our communities to feel just a little bit safer knowing that they can both utilize psilocybin in communal settings, in ceremonial settings, and not necessarily have to worry about law enforcement intervention. We want to expand the scope of the panel, which really includes bringing in more voting members and specifically making sure that the Denver panel is much more diverse and representative of our rich culture and diversity here in the city. In our last, in the actual comprehensive report submission, when we spoke with members of our city council, they also wanted to see more health professionals in there, and specifically some folks from the Denver Department of Public Health and Environment, for example. And then finally, we're asking the city to explore the therapeutic application of psilocybin in Denver. And that can look like a lot of things. That could look like safe use sites, brick and mortar locations that are in part sponsored by the city, where we're, potentially exploring using psilocybin as a treatment option for, retired first responders, for example, who are suffering from PTSD, other folks who are suffering from PTSD. That could also look like a research site, for example, like with the University of Colorado. We are asking the city to basically say, hey, we know that psilocybin is safe for most people when used in appropriate contexts. And, what can we do here to start to address some of the mental and behavioral health crises that we're facing as a city? So we'll go to the next slide. Thanks, Jen. So we have Denver and all the important work that we're doing here in the next couple of months in the city. And then also we just recently refiled and resubmitted the Natural Medicine Health Act of 2022. So that was delivered last Thursday to the Colorado Legislative Council. And this is a ballot initiative that we are hoping to have appear on the ballot for the election in November. And kind of an overview here, this act would fully decriminalize DMT, ibogaine, mescaline, not including peyote, psilocybin, and psilocin, and also create a two-tiered regulatory access program that starts with psilocybin and psilocin. And then in the future, pending our advisory board recommendations, the program may also regulate the remaining natural medicines, which would include DMT, ibogaine, and mescaline. And, we have a lot of work to do, reminiscent of our signature gathering efforts in Denver. 3 years ago, where we had to collect about 5,000 valid signatures. This time around, we need to collect 124,632 valid signatures from registered Colorado voters, which actually means that we need to collect around potentially 250,000 signatures, given the actual validation rate to appear on the ballot. And, we will be getting to work on collecting signatures here, hopefully in the next 4 to 6 weeks. So going into some of the key policy points with the Natural Medicine Health Act of 2022, our personal use provisions, full decriminalization of these natural medicines goes into effect immediately upon passage and ratification of the initiative. So if this measure appears on the ballot and we're successful, the governor ratifies a couple of weeks later, and these natural medicines will be decriminalized at that time. And then the access program itself would be regulated by the Department of Regulatory Agencies, which is known as DORA. And so this program would be setting rules for licensed healing centers, facilitators, and also healthcare facilities, so that facilitators can offer these natural medicine services. And I really wanted to highlight, so much of our focus here was how can we learn our lessons from the past and do our best to ensure that we're making this as accessible to as many people as possible. And more specifically, our marginalized populations who have been historically negatively impacted by the drug war and over policing. This also includes, our indigenous communities and also veterans. So we want to make sure that this program is actually, when we're talking about, equity and inclusivity, what does that mean? And in the regulatory agency portion of our language, there is a provision there that mandates that we really figure out how do we identify these communities, and how do we create policies and programs to ensure that they can have access to this, which includes reduced fees for licensure and training, reduced cost of services for low-income individuals, and then even probably more importantly, incentivizing in terms of licensing geographic and cultural diversity and actual availability of these services. We do also have an advisory board. This advisory board makes recommendations on all of the rules, including the accessibility provisions. It also publishes an annual report. And we wanted to make sure that the advisory board isn't only a group that makes recommendations to the regulatory agency. And so there are provisions in the language where the regulatory agency needs to consult with the advisory board before making final decisions. For example, in terms of the other natural medicines to be regulated, that would come with advisory board recommendation. And there are some other provisions in the language that are really tightly focused on making sure that when we're creating a regulatory access program, that this is accessible to all Coloradans, and especially our most impacted and marginalized communities. So the timeline in terms of Denver, we're working on getting our next meeting scheduled, which is always fun because everyone's so busy. But we're looking at our next panel meeting in mid-February. And at that meeting, we're really going to establish the foundation for the continuation of the panel and really examining all of these recommendations that we're making. And, after that meeting, we're going to get to work, working directly with members of city council and policymakers, because there are some provisions or there are some with our recommendations, we will need to create a new resolution here in the city to authorize gifting and sharing, for example, and potentially decriminalize other entheogens to really catch up with the rest of the country. And so we're looking at, both like internal communications and lobbying really with our Denver City Council, kind of March through June, while at the same time, creating more town halls and more community events to really make sure that we're, hearing from Denver residents. The potential for the multi-responder training can be launched in potentially spring 2022, pending, the bureaucratic hurdles that we have to go through there. And we could be looking at a new state of decriminalization in Denver this summer. Next slide. And then in terms of the Natural Medicine Health Act of 2022, this month, February, is a big month. We have our alleged council and title board hearings in February. As I mentioned earlier, we have the potential to be collecting signatures possibly early March. And again, we have to collect 250,000 signatures to qualify. And, I'm not quite sure how long that's going to take, but I think we're going to get it done. And then really this summer and fall, focusing on, really educating and reaching out to Colorado residents to vote yes on this measure when it appears on the ballot on Election Day, November 8th. Thanks, everyone.
Thanks, Kevin. Appreciate that. That was great. We've got a bunch of questions. I think we've got the most for Jordan and one for Josh and Kevin each. So Jordan, if you want to jump in and answer a couple of these, then we can move on to Josh and Kevin.
Sure, happy to. Doing my best with all the questions. So the first one, are we only going for plant-based medicine in Colorado? Legalize LSD, which I think I added the exclamation point on my own, but felt like one was deserving there, given the nature of the question. So given the temperature at the Colorado legislature, at this time, a decision was made to focus on naturally occurring psychedelics as opposed to things like LSD and MDMA. There are other efforts going on in Colorado around psychedelics reform, and we believe that there would be opportunity to kind of expand those discussions over time, but a political calculation was made about viability of the legislation, at least as it relates to non-naturally occurring psychedelics, and therefore the bill would just include the list, at least initially, which could be amended through a variety of things thereafter. Second question is, with psilocybin being a fungal-based medicine, are you considering the misnomer there, including psilocybin as a plant-based medicine? That is actually one of the things that we did talk about, and is a very good question. And I think we just decided that, the law as opposed to biology sometimes don't need to perfectly line up, and that the goal that describing things as plant-based medicines, even if some of these are actually fungal based medicines, probably works at least to get to the end goal of really creating the kind of reform we're trying to drive for. And that, I guess in some ways fungal based medicines just doesn't have quite the same ring to it. So, I totally recognize that some of our vernacular is not technically correct, but at this point, we're trying to balance, kind of technical accuracy with getting things across the finish line. And we felt like this was probably the best way to structure things for now. But that's the beauty of kind of having the panel reassess the definition and terminology. And there may be recommendations to say, hey, maybe this should be naturally occurring medicines, or, expanded beyond that. And so definitely looking forward to having those conversations throughout the process. And then finally, will these meetings be public? Yes, pursuant to various Colorado Sunshine laws, that these meetings would absolutely be available to the public. And then obviously, usually there's typically opportunities for public comment, written feedback, and all kinds of other engagement. So the engagement doesn't stop at the legislative session. That's just the first chance for engagement in this kind of stuff. And we hope that you do get engaged, and happy to answer any other questions. But I think those were the ones that were on the docket for me that I saw initially.
Awesome. Thank you, Jordan. Josh, you want to field that one about how folks can help out with legislative efforts?
Yeah, well, Kevin put his email in the chat, for those who want to help out on the initiative, and, emailing Jordan, which I'm sure his email is here somewhere, on the legislative piece. There's definitely ways you can get involved. And I'll sort of, kick things over to Kevin. Well, actually, I'll answer Mike Elliott's question. The Natural Medicine Act is a statutory piece of legislation, not a constitutional amendment. And, there's not, and 5-MeO-DMT is not expressly listed in either the legislative bill or the Natural Medicine Act, for those questions. And actually, while I have the mic, I'll also comment on a piece in the chat where, it is, we are looking at, psychedelic natural medicines, or psychedelic plant-based medicines, so that at this point, doesn't, include cocoa leaves or opium, which are also sort of like plant-based medicines. But great point.
I think, Josh, you probably covered the questions that may have been directed to me as well. I think the constitutional versus statutory, that's a good question for folks to understand. In the state of Colorado, for a constitutional amendment, it requires 55% of the general vote and actually a percent of signatures gathered from all state counties. Natural Medicine Health Act is statutory, but we do fully, we're excited to be all over the state this year collecting signatures, and just really knowing and understanding that Denver, and well, not Denver, but Colorado really is a deep purple state here. And so we have a lot of communities to reach out to and have discussions with regarding the initiative.
There's a question about and thanks, Kevin, about other states, what other states are moving forward with legislation. And there are so many. We didn't even try to cover all of them. We could have spent the entire hour just going state by state. There's a lot happening in Massachusetts. There's stuff in Missouri around the Right to Try Act. That's really interesting. Michigan, Iowa, Utah. There's so many states that I didn't even try to cover here. Specifically with regard to your question about Florida, I think Florida has actually introduced relatively recently a bill that pretty much mirrors the Texas language around directing the state to initiate research into, I believe it's psilocybin psilocybin, MDMA. Hold on, I actually have it right in front of me. It's not limited just to psilocybin, if I recall. It's ketamine, psilocybin, and MDMA to treat various conditions, including like PTSD, chronic pain, migraines, like a relatively broad list of conditions, and mostly mirroring the Texas language. So there's a lot of movement that we didn't try to go into. We wanted to give you guys some of the meat of Oregon, California, and Colorado. Any of the panelists have any final comments or anything like that? We're sort of right at time.
No, I would just like to thank all the panelists for joining us, and everyone who, who attended the webinar as well. Big thanks.
Yeah, thank you, everyone. We really appreciate your support.
Thank you, everyone. It was great to have this experience, and awesome seeing so many folks from our community in the chat. So thank you for being here.